Hi everyone, welcome to week 3. Hopefully everyone's had a little bit of time to get into a routine. I know that I think I have kind of found my groove within the class and seems to be working out well. I hope it's working out for you as well. Little bit of apology if you can hear my dryer in the background of this presentation. I apologize. I have to multitask when I have time. So this week we're going to get started on the ethical aspect of our class. And what better way to start than with the subject of research in global health, because there's so many ethical issues at play here. So first of all, as always, I start off with a little bit of our terminology that we use. Epidemiology is the study of distribution and determinants of morbidity, mortality, and disability in populations. This actually uses a lot of statistics, which you will see further down in the slide. Just to give you a little bit of information, in the state of Idaho, most of our state epidemiologists are veterinarians. Interesting, but when you think about the kind of infectious diseases that we see within our state, so West Nile, Lyme disease, things of that nature, it actually kind of makes sense that our epidemiologists are veterinarians. Going further down, statistics. Now, statistics, I have kind of a love-hate relationship with it. Statistics is the study of the collection, analysis, interpretation, that being the key word, presentation, and organization of data. Now, one of the things that you will find about me is I rarely take statistics at face value, and this, I guarantee, will be a question on our final exam. Statistics can be skewed to show whatever the researcher wants it to show. It's all based upon interpretation. Please remember that when you hear things like studies have shown 4 out of 5 dentists prefer Colgate. Well, you have to dig into that a little bit deeper. I want you to question, well, where did they get those 5 dentists from? Are they employees of Colgate? Why are they only sampling 5 dentists? Why aren't they sampling 100 dentists? So things to just kind of ask yourself, that I find it very difficult to accept statistics at face value. I really like to dig in a little bit more. And I think what really solidified this for me is taking statistics in grad school and learning, tying it into epidemiology and really putting that into a health aspect and learning to question certain things. So enough of my personal opinion on statistics. Really pay attention to what sample size someone's using and where that sample is coming from. Okay, so when we're talking about research, so we have levels of studies to gather information. A primary study is that a brand new data set. So they're collecting it from a clear-cut and well-defined population. A lot of these are observational. A lot of these are questionnaires. I'm sure many of you have been stopped in the mall by someone asking you to complete a brief questionnaire. This is an example of a primary study. So then secondary study is analyzing and reporting on that data. So you get the results from the primary study and then analyze that and create some kind of report on that data. So that would be your secondary study. And then a tertiary study is the collection of research from primary and secondary studies and summarization of each. So you'll find this in peer-reviewed articles where they've created multiple level of studies to get the information and are now presenting it in some kind of journal article. Observational studies are just like they sound. It really, there's no intervention. It's very, or I should say it's non-invasive at all. It's really just asking people about what they're currently doing or what they've done in the past. So again, surveys, questionnaires, those things that, you know, someone may call, someone may approach you in the mall, on the quad at at school. One of the things that falls under an observational study, and I find cohort studies to be rather fascinating because what it does is it follows a similar group of people. That's how we come up with the term cohort through a period of time. Usually it's years, sometimes it may be months, and they follow the outcome of these people. So they may, for instance, let's take a group of first graders that are given a certain reading intervention. And they follow that group of first graders through graduation of high school, and then they remeasure and see if that intervention has worked. Cohort studies can be really useful to determine patterns, determining interventions that can be used to affect large groups of people based on that population size. And then we have experimental studies. This is what you will find the Food and Drug Administration uses, the FDA. Any new medication that comes on the market must go through intervention studies, experimental studies, clinical trials for new medications. So without getting too deeply into the subject, because we could honestly spend an entire semester talking about nothing except clinical trials. I used to work in clinical research. When we get to the end of this PowerPoint, I will explain why I'm no longer involved in that. But two of the types of clinical trials for new medications that you need to know are the randomized controlled trial, in which people are assigned by chance. Everyone has an equal opportunity to be assigned to either the experimental group or the comparison group. So it's usually generated randomly by a table of numbers, and researchers do not know who's being assigned to what at that time. Then we have a double-blind study. These are the most common in a pharmaceutical clinical research study, in which neither the researchers nor the participants know if they're receiving an intervention or a placebo. I'm sure you've all have heard of the placebo effect, where a participant may think that they're receiving a benefit or seeing some kind of reaction to a medication when in fact they're receiving a placebo. So, ethics within research. There are so many ethical aspects within research, and that's why I feel it's always a good time to introduce the ethical aspect of our subject, global health, within this particular chapter. So there is an oversight committee, institutional review board, that oversees all clinical research. They have been tasked with approving all research studies to ensure that the risk is minimal, that participants know that their participation in such a study is voluntary and that they may drop out at any time. It also wants to make sure that they are aware of any and all risks, procedures, any time and money that are required, and to be assured that their personal information will be protected and not shared with anyone. Usually within a research study, results are taken in an aggregate, and so it is reported, and you'll see that that's where that 4 out of 5 dentists come in. They're not going to identify them by name. It just takes the information in aggregate. So IRBs exist at just about every level, and I'm just going to talk about mainly the medical aspect, but at every level of a clinical or hospital setting. St. Luke's has their own IRB. St. Alphonsus has their own IRB. Boise State University has their own IRB, because certainly within higher education there is a lot of research going on. So that IRB is a key entity within any type of research and really is there in place to ensure the ethics within research. So again, ethics, this is an ongoing theme, and we are going to incorporate ethics into everything this semester from here on out. So What our discussion question is going to involve this week is going to be what if any, ethical aspects you feel um, influence you in clinical research. So obviously, there's so many. It's literally endless. So testing on animals. Is it fair to test human medications on animals? If you're an animal activist like I am, I have a huge ethical issue with it, which is 99% of the reason I'm no longer involved in clinical research. Testing on humans as well could be considered an ethical issue as well. Placebo versus treatment for known conditions. Sometimes a participant in a study may think that they're receiving an active intervention and have very high hopes on perhaps delaying onset of cancer or reducing symptoms of a disease, and that it turns out that they're receiving a placebo. There is a reason for clinical research and research to be done. But what we have to ask ourselves is it balanced out ethically? Another thing we have to look at, especially right now, we've all heard of the EpiPen going up in price. So we've got the financial aspects of the big pharmaceutical companies. Another huge aspect that we need to look at. So this will be the theme of our discussion question this week, is how, if any, ethics enter into our own way of thinking when it comes to research, clinical or otherwise. So with that, I'm going to end this audio, and I will move on to the ethics part, the ethical theories, and we will continue from there.